Assalamualaikum, my name is Nur Alina Natasha binti Ismail. My metric number is 30DLS2100009. So I'm going to discuss about 4 methods of Malaysian MCO implementation in land transport. So firstly, actions land for land cargo, which is truck, van, wagon, pickup, car and motorcycle. So it is recommended to use the mode of cargo transport by rail. Next, is it also recommended to operate from 7 p.m. until 7 a.m. only. Vehicle use need to undergo cleaning and disinfection periodically in accordance with the MOH guidelines for cleaning and disinfection procedure. Next, capacity limit of public service vehicle, which is physical distancing. 50% capacity based on seat except for Sabah. The allowable capacity is 50% only with physical distancing marking. Other than that, no marking of physical distancing. However, passengers are asked to reduce interaction and perform physical distancing. For the third method, we have cleaning and encourage the use of electronic facilities and transaction. For the operation of KTMB passenger rail service such as ETS, MRT and LRT, they need to clean offerings and facilities after each trip as well as at the depot after ending of operating time. Secondly, it provides automatic doors for the entry and exit movement of passengers, so there's no physical touch in every movement. Other than that, encourage the purchase of tickets online and the use of non-cash transactions cards such as monthly pass and touch and go. Lastly, for the fourth methods of Malaysian MCO implementation in land transport, we need to checking employees and passenger temperature. Firstly, we need to check the body temperature of passenger and employee using a temperature imaging camera and thermometer before they enter the paying area. Other than that, passenger and employee who are symptomatic and have a temperature above 37.5 Celsius will not allow in and are advised to seek medical examination immediately. That's all.
Assalamualaikum and hello. My name is Nusara Sofia binti Samsul Bahari and my matrix number is 30DLS21F1027. Flight Operation Guidelines (FOG) for aircrew is to ensure that safety of all aircrew is maintained at the highest level possible while operating in the midst of this crisis. In order to maintain safety of both personnel and aircraft. This FOG draws of the information and guidelines from the work of ICAO Council Aviation Recovery Task Force SART. It must receive certificate and license holder issued by validated by CAAM. Crew member maintains and cargo load specialized personnel who are involved in flight with a stopover should not need to be medically quarantined and observation while a layover are observed after returning unless they were exposed to a non-symptomatic passenger or crew member on board or during the stopover. So crew members should monitor themselves for fever, cough, shortness of breath or other symptoms of COVID-19. A measured temperature of 38 degrees Celsius or higher is the WHO case definition where it's actually a symptom of COVID-19. Crew members should take their temperature at least twice per day during duty periods and at any time they feel unwell. And crew members should stay at home or in their hotel room, notify their employers, and not report for work if they are develop a fever or any symptoms of COVID-19. If a crew member develops symptoms during flight, they say crew members should stop working as soon as possible or put a surgical mask, notify the pilot in charge and maintain the recommended physical distance from others when possible to do so. Upon landing, individuals should follow up the airline's medical and public health officials. Now I am going to explain what is the purpose of air traffic management. The air traffic management system shares its constant attention and practices of high-level safety and health measures in order to ensure that support for all operators is delivered efficiently. What is the objective of air traffic management? It is actually to provide safe, orderly, economic and expeditious flow of air traffic management. So in conclusion, the aviation industry is a visual connection in the economy, not just for passengers but also for the freight process. In all operating activities necessitate the highest level of safety precautions. CHAAM will continue to keep a close eye on developments of COVID-19 pandemic to ensure that safety measures and guidelines are up to date and reflect the most recent findings and recommendations from international and national public health agencies.
Assalamualaikum. My name is Nurul Alia Natasha binti Kamal Zaman. My matric number is 30DLS21F1029. Four method of Malaysia MCO implementation in aviation transport. Third method is airworthiness guidance. For this method, I have three guidelines. So the first guideline is common cleaning, disinfection and safety measure for flight deck, passenger, cabin and cargo compartment. Objective is to provide harmonized cleaning, disinfection and safety measure to be undertaken in flight deck, passenger cabin and cargo compartment. The things need to do is cleaning and disinfection process should be done in accordance with the established operator procedure. Cleaning and disinfection solutions are flammable, so precautions should be taken around potential sources and ignition. Clean surface of dirt and debris before disinfection to maximize effectiveness. The second guideline is specific disinfection measure for flight deck. Objective is to provide harmonized cleaning, disinfection and safety measure to be undertaken in flight deck. The thing to do is, given the increased likelihood to switch position may be inadvertently changed during cleaning or disinfection process, operator and flight crew should be reinforced procedure to verify that all flight deck switch and control are in the correct position prior to operate of the aircraft. Some equipment on the flight deck may have additional disinfection requirement based on usage. For example, oxygen masks, and procedure should be put in place accordingly. The third guideline is specific disinfection measure for maintenance. The objective is to provide harmonized cleaning, disinfection and safety measure to be undertaken in overall maintenance. The thing needs to do is airline operators should be mindful of regular maintenance to both air system and water system to ensure they continue to protect the passenger and the crew from viruses. Refer to the airframe OEM for specific maintenance and action and interval. It is recommended that airlines or operator include access panel or other maintenance area in their disinfection procedure to ensure a safe environment for the maintenance personnel. Airliner operator may wish to review the operating procedure to minimize the number of personnel who need to contact high-touch surface such as access panel, door handle, switches, etc. The fourth method is aviation security guidance. They also have three guidelines in this method, which is the first one is checkpoint access procedure and for passenger and staff. The objective for this guideline is to provide
clarity on measures to be undertaken at the checkpoint access to ensure safety of the personnel, crowd management, and confidence building. The thing needs to do in these guidelines is appropriate procedure should be implemented in coordination with the relevant government department in order to respond to any passenger showing signs of illness. Second, hand sanitizer and disinfection products should be provided prior to passenger and staff screening access point where possible. Automatic gate and mobile scanner reader surface should be disinfected with the same frequency as for any other high-touch surface. Second guideline is passenger security screening. Objective is to provide clarity on measures to be undertaken during passenger security screening to ensure safety of the personnel, crowd management, and confidence building. So the thing need to do is alcohol-based hand sanitizer should be distributed to scanners for the cleaning and disinfection of their hand. Scanners should be wear gloves and change them after each manual search. Scanners should be advised to wash or sanitize their hand after removing gloves. The last one is identification check at department hall. The objective is to provide clarity on measures to be undertaken during identification check to ensure safety of the personnel, crowd management, and confidence building. Procedure involving passenger presenting a boarding passes and other travel documents to security personnel should be done to the extent possible while avoiding physical contact and in a way that minimizes face-to-face interaction. Should there be a need to identify a person wearing a mask against a government issue photo identification, the mask could be removed if physical distancing measures are met.
Hi, Assalamualaikum. My name is Wanu Farisa binti Wan Abdul Faris and my matric number is 30DLS21F1037. 4 meter of Malaysia MCO implementation in maritime transport sector. First, cross-boundary cargo. All sea crew and workers are required to wear face masks and are required to undergo symptom and temperature screening as well comply with border control rules agreed between the Malaysia government and the related country. And next, the employees also must be practice physical distancing and perform symptom screening. Secondly, relevant agency under the MOT limit the frequency of sea transport services. Following the decision of the National Security Council (NSC) to tighten the Malaysia Movement Control Order (MCO) in dealing with the COVID-19 pandemic situation, the Ministry of Transport Malaysia (MOT) has limited passenger capacity for all mode of service, including sea transport up to 50% of capacity maximum. Thus, ferry service are allowed to operate at 50% passenger capacity.
Changes in maritime trade reduce port calls. Data from the automated identification system, which tracks ship movement, provide near real-time information on marine transportation and trade. Traditional data sources and methodologies that rely on national government statistics are typically delayed. Therefore, this helps fill in data gaps. Next is the Minister of Transport issue measures to ensure continuous supply of essential goods during MCO. Given that currently Port Klang, Port of Penang and Johor Port in Pasir Gudang have reached nearly 100% of their capacities to hold goods, thus impeding the supply and transportation of essential goods, the Minister of Transport has proceeded to instruct that the affected ports be given special exemption to clear non-essential goods to warehouse outside the port area temporarily so they can continue to release essential goods promptly and immediately.
What is the impact of implementation in transportation sector in Malaysia? I am going to explain about air transport. According to the Transport Minister Datuk Sri Wee Kong Siang, Malaysia aviation industry is projected to lose 13 million ringgit this year as air travel continues to face travel restrictions. Malaysia Airlines is undergoing an urgent revamp to preserve its survival, having scaled down its operation, institute salary cuts, and offered unpaid leave to almost 13,000 of its employees since MCO began. Now I'm going to talk about the impact of implementation in transportation sector in Malaysia. I'm going to explain about road transportation. I choose GNT and Post Leisure because they gain lucrative profit during COVID-19 pandemic because of the occurrence of MCO. This is because all the people cannot go out to the store to shop, so they have to use the online shopping method.
For impact of the implementation in transportation sector in Malaysia. The first impact is for freight transport. The freight transport system is less impacted by the pandemic. Instead, due to the change of travel and purchasing behavior, the freight transport in some country might experience growth in their traffic. When people are encouraged to stay at home and reduce contact with others, many families have sources, online websites, and mobile apps to buy their necessities. For the second impact is for rail transport. This picture shows the driver sheet comparison of year 2019 and 2020 for various rail transport system in Klang Valley area. It is observed that the KLIA Express and KLIA Transit service, which provide the direct transport connection between KLIA Airport and city centre, is more hit by the pandemic. The ridership has reduced by 67% in year 2020 as compared to year 2019. This is followed by Kelana Jaya LRT, which is 60% reduction, intercity train, which is 55% reduction, and KTM commuter train, which is 53% reduction.
So, as a citizen, full of our responsibility towards this issue. First of all, I will comply with the SOP that have been directed by the Ministry of Health of Malaysia. As a responsible citizen, I will always abide by the SOP set while in public places such as in the workplace, school, etc. And by taking care of my personal safety and others, I will always wearing a face mask, practicing safe social spacing of at least 1 meter, including in the workspace and dining room. At the same time, I also will keep the dining area or shared facility clean. Thus, if I have symptoms, I will do self quarantine in order to reduce the risk of the disease spread and get an immediate examination. Next, support local business in our country. As a responsible citizen, I will support our country local business. For example, I will use the Shopee, Lazada, and Grab platform to order their food or product to purchase it. Thus, I can help those traders in terms of buying their goods, as well as traders will also profit in terms of I buying their food or product item. At the same time, it benefit personnel in the field of transportation service, since they will be able to profit in terms of food or good delivery charged to customer via land transportation air transportation, or sea transportation to deliver the product to the destination requested by the customer. So it can be concluded here that if we buy or support local business in our country, this can reduce the rate of poverty or unemployment in Malaysia. In fact, transportation service will also work for the delivery of goods to customers.
Must follow the government instruction. According to a poll of nations conducted during the first phase of MCO, 75% of respondents said they would only leave the house to buy essential things. In the third phase, 90% of the participants refused to leave the house at all, and only family members were let inside. The MCO was issued by the Malaysian government to restrict the spread of coronavirus. It was originally planned to run for 2 weeks starting March 18, 2020. For the third time, it has been extended till June 9. Last one is alert with the current situation. Inside your home, avoid close contact with the people who are sick if possible. If possible, maintain 6 feet between the person who is sick and other household members. If you are taking care of someone who is sick, make sure you properly wear a well-fitting mask and follow other steps to protect yourself. And the last one is indoors in public. If you are not up to date on COVID-19 vaccine, stay at least 6 feet away from other people, especially if you are at higher risk of getting very sick with COVID-19.